are my three people.
I'm Gerald.
Kathy.
Demetria.
Okay.
So my informative speech is on drug addiction. Over 7 million Americans in 2014 battled with a drug disorder per NSDUH. Today I will present information on the use of drugs. First, I will inform you on what drug addiction is. Secondly, I will talk about the statistics of drug use. Third, the effects of drugs. Drug addiction is defined as a chronic disease characterized by drug seeking and use that is compulsive or difficult to control, despite the consequences of the use of drugs. Most who partake in the use of drugs is voluntary. However, the continuous use of drugs can affect the brain and put a person at risk of an addiction. It affects the human self-control to stop using. According to NIDA, these brain changes can be persistent, which is why drug addiction is considered a relapsing disease. People in recovery from drug addiction have an increased rate of relapsing, even after years of not using. There is no one person who can be affected by the use of drugs or drug addiction. There are many factors that contribute to a person's addiction to drugs. The American Society of Addiction Medicine reports that in 2015, approximately 586,000 people around the ages of 12 and up have used heroin and have suffered from a substance disorder involving heroin. In 2014, the ASAM also published that over 2 million Americans ages 11 struggled with opioid and reliever abuse disorder. According to NIDA, almost 6% of full-time college students in the United States use marijuana on a daily in 2014. This is more than triple the number of daily smokers in 20 years prior. NIDA relapsing is common in addiction treatment. Relapse rates are between 40 to 60%. The use of drugs has a strong effect on the body, the brain, and the person's behavior. The effects of drugs impact the body more and more, and there are long-term effects on the body. According to the National Institute of Drug Abuse, many drugs affect the brain reward circuit, thus causing euphoria as well as flooding it with chemical messenger dopamine. Surges of dopamine in the reward circuit cause the reinforcement of pleasurable but unhealthy behavior. Like taking drugs, there are long-term symptoms that stay within the body and can be semi to permanent. Long-term use also causes changes in other brain chemical systems and circuits, as well as affecting functions include learning, judgment, decision-making, stress, memory, and behavior. According to GatewayFoundation.org, the effects of drugs can cause a weakened immune system, heart condition ranging from abnormal heart rates to heart attacks and collapsed veins and blood vessels. There is also a risk of infection from injection of drugs. The effects of behavior range from paranoia, aggression, and hallucinations. In our first point, we discuss what drug addiction is and how we use drugs and how drugs lead to an addiction. The second point discussed the statistics of drug addiction and those it affects. In my third point, I discussed the long-term effects of drug use on the brain and body. Today we talked about the information on drugs, what drug addiction is, and the stats behind it, and how it affects the person. In conclusion, drug addiction is a serious issue and affects the body long-term and leaves permanent damages to the user. There are many resources to help end drug addiction and many ways to prevent the further cause of addiction. Thank you.